Hello, I am Dr. Gaurav Agarwal, Consultant-Interventional Cardiologist, Narayana Multispeciality Hospital, Jessore Road, Kolkata. Today, let's talk about a very common thing, that is high blood cholesterol. We are all aware that high blood cholesterol leads to heart disease in the future. But we see so many patients in our practice who come with no symptoms, but they coincidentally got a lipid profile done and they found that their cholesterol is high in the form of elevated LDL cholesterol, or let's say their triglycerides are very high. This triglyceride entity, particularly if I talk about our Indian population, triglycerides are found to be very high in a significant proportion of Indian population, amounting up to the extent of 40 to 45%. And this is because of two factors. One is because of genetic predisposition, and the second is our dietary habits. Our current dietary regimen is composed in such a way that it is very rich in triglycerides. Let's say if we talk about our regular diet, we consume lots of oil, fatty food, and lots of carbohydrate rich diet. A very important thing that we need to understand, the more of free sugars, the more of simple carbohydrates we take, that is eventually going to get converted into triglycerides, and then in the form of low density lipoproteins in our liver, which will eventually get deposited in our blood vessels and will lead to heart disease in the future. So now we need to know, what do we need to do to stop this cholesterol from accumulating in our body. The first and foremost thing, if you are an alcoholic, stop alcohol consumption. Second, avoid all oily foods, fatty foods outside, and junk foods. Try to consume fresh fruits, vegetables. Consume least amount of oil as possible, and preferably, if you can afford, I'll recommend you to use olive oil as far as possible. Some amount of ghee can be used, that should not be significantly harmful, and definitely it will not lead to any further conversion into long standing heart disease. And then the most important thing, if you are overweight or obese, reduce your weight by exercising regularly. 30 to 45 minutes of brisk walking or jogging should be done. That will lead to weight loss, reduce your triglycerides and LDL levels, and then it will also increase the HDL levels, that is the good cholesterol, which is very important for our heart. Thank you.